Hello and welcome to Health Sciences Update. Today our guests will discuss global health and the role of education and research universities. Here are WSU Spokane Chancellor Lisa Brown and Lisa Cohen, Executive Director of Washington Global Health Alliance.
Lisa, I'm so happy that you could join me for the program. You and I met in Seattle, and I was very impressed with the work of the Washington Global Health Alliance. So why don't you tell us a little bit about it and how you came to be part of it?
Well, the Alliance is really an opportunity to connect this tremendous concentration of global health expertise we have in this state. I mean, we have more than 200 global health nonprofits, not to mention all the businesses, and then these phenomenal academic institutions. So we formed the Alliance in 2007. I can't believe we're starting our 7th year now. And we wanted to provide an opportunity for connections, and so we can enhance the collaboration, avoid redundancies, help people understand what's going on with each other. And my background is as a journalist, and I got to cover some global health stories and then learned about the tremendous work that was going on. And it honestly feels a little bit selfish because I get to be around all these amazing people who've been devoting their careers to saving lives in the most challenging circumstances.
Well, I was, when I first came on at WSU a little over a year ago, I had no idea that even the Spokane campus was so connected to the global health movement, which I really believe it is. So, for example, our speech and hearing program, which is a collaboration between Eastern and WSU, takes a group of faculty and students to Guatemala in the summer, and they work with community centers and child care centers and do on-the-ground work, which of course is beneficial to that community, but really also very beneficial to the students, giving them that transformative experience of being in another country, in a different culture and language being spoken, and still making those connections to health and improving and strengthening a community. Our nursing students go to Peru, and those are just a couple of examples of the many global health connections that WSU students and faculty have. Maybe you could also tell me, have you participated yourself in any of these endeavors?
I have, whenever possible. I like to go and see what's going on in the field. Unfortunately, I'm more stuck in the community here in the state and in the country, making these connections. But I will say that our students, this generation, they are global citizens, and they understand that the boundaries that have traditionally existed, those country boundaries that we think of as separations, are non-existent anymore. And as the more we can learn from being working in these places, we have a lot to offer, but we have as much or more to learn about what's going on and how we can do better in serving. Global health is really about serving the most vulnerable people, and that doesn't matter whether they're in Guatemala or Peru or they're in Spokane County or in south of Seattle.
Yes, and that reminds me of another organization that you are part of and that WSU is becoming a partner to just this week, and that is Global to Local. And maybe you could tell me a little bit about Global to Local and its philosophy, because I think it really resonates with what you just said.
It is. I'm so excited about this program. Global to Local is all about taking what we've learned in these global programs and applying them to improve health outcomes here at home. So we often think as Americans that we're there to go help, we have all the answers, right? And the more humility with which we can approach these issues, the more we're going to learn. We have healthcare costs that are just out of sight and are unsustainable here in this country. And so we can learn from what these global health organizations such as World Vision and PATH and WSU and the University of Washington and others are doing in these developing countries and apply those lessons here. So that can be everything from community health promoters who are members of the communities, and that might be communities of Ethiopia, Ethiopians or Somali or are Mexican, but it also is different people that we think of as, it could be African American, it can be different cultures of white Americans. So we shouldn't just think about this in terms of international work. Anyway, we have those things. We have community health workers who go out. We use mobile technologies, so everybody's got a cell phone. So how can we use that for health delivery and promotion? And I know the students here at WSU are coming up with amazing ways to approach that. And then the third element of health is being active and engaged in your community and having a voice. You know this from your background. If you can help influence policies, if you can help get better food access to fresh food or more transportation or better housing, that's going to contribute to your overall health. So we work in those areas, and we are so excited to have WSU come on board because one of the key issues that we're addressing is nutrition, and there's no better source of expertise in WSU there, and so applying that here.
This has been really fun to start to see this connection between the different strengths of the university. So of course the traditional strength in agriculture and food security, and that of course has applicability whether you're talking about a village in Africa that's struggling with clean water, or whether you're talking about a new community garden down the street that WSU Extension is helping to create. So from food security, there is also the piece about animal health. And of course, we have this renowned global animal health expertise as well. And I was completely unaware of how significant animal health is to human health, because so many diseases are transmitted from animals to humans. So food security, animal health, and now this human health piece. And what I really like, as you mentioned, is the behavioral piece. It's obviously it's great to have the latest technology and the most current vaccination and the best therapies and techniques to address a disease once you already have it. But this piece where you take a step back and try to prevent disease or get community members engaged in identifying and working in their own community to improve the health of their community is really exciting. I saw this personally last year when I went to Africa, when I was still a faculty member at Gonzaga. We went to this community, and these, what you call community health promoters, they are not necessarily healthcare professionals. They work with healthcare professionals, and healthcare professionals can help inform them, but they're the ones that might make the trek out to a village that is not accessible by car, and meet with a group of mothers and talk with them about the symptoms of malaria, help people understand HIV/AIDS transmission, and really be those on the ground trusted voices in a community. You and I also share this passion for the empowerment of women, and many times these are women. These are women in these local communities, and they are working woman to woman, mother to mother, mother to daughter to try to improve the health of their community.
You know, I'm really, that's a very important point, because I'll never forget the man who's now the head of global development for the Bill and Melinda Gates Foundation, Chris Elias. Someone asked him once if you could do anything in health, and this is a man who's been, he's an MD, and he's been really involved in the clinical side of things. He said, if you could do anything, what would you do? He said, I would have girls ensure that they could get a secondary education, because that's what's going to change things. And we have to think about this all as one. And that's what I like about the WSU campus here in Spokane, because it's so intimate and there is all this interaction. So the pharmacy students are talking with the medical students, are talking with the nursing students, are talking with speech and hearing and education. And we need to have all those players in a community engaging and working and together to come up with solutions. The other thing that's absolutely critical, and we've learned this in global to local, and it's something we've known in global health for a while, is to ask the communities what they need. So whether that is out, if you're working in a rural location or in a part of Spokane or in Seattle, if you don't engage the community as partners and ask what they need, then all of the solutions you might have, people aren't going to do it because they aren't invested in that, and it may not be a priority for them.
Right.
And so I know that with all of the rural work that the students here are doing, that they're learning that, and it's going to serve them so well in the long run.
I agree. And the other thing that I have noted is that this team-based approach that we're working on here is really mirrored also in the global network out there, because we know there's a scarcity of healthcare professionals at the very, so there's not enough doctors. That's going to get even worse as the population ages in our country and physicians retire, and with the Affordable Care Act, more and more people that have are entitled to health care coverage, but not necessarily access to an actual healthcare provider. So whereas we're very excited about the medical education that's happening on our campus and we want to expand it to meet the need, we know that it's not all about the doctors. And the nurses, the pharmacy students, the paraprofessionals, dental hygiene, the importance of dental health to human health, and putting all these together in a team-based approach is one of the things we're very excited about. And I would imagine in a international setting, these healthcare teams could also be pretty transformative because they all have a piece of the solution, and if they work together, they can offer more.
Right. It's key. I mean, it's the only way that you're going to have that impact. And as you say, with if you look at the statistics, people spend less than an hour a year in a doctor's office. I mean, they're out in the community, and we need to be thinking about prevention. We need to be thinking about education, about engagement. And it's the members of the community who will be the army on behalf of these doctors and nurses. And the more that they can engage and think of creative ways to involve the community. And I love that WSU is thinking in these ways, because we've got to change our approach to this system, and it's only going to be done through that sort of teamwork that you're talking about.
Great. We had some students this year that did something fun in connection with research. Students went out and did kind of a health promotion in middle schools and elementary schools, and they did vital statistics and weighed the students and got them engaged in their own health and fitness, and talked with teachers about how to do that as well. And then we had one of our researchers engaged in a scratch cooking project in the schools. So they cooked from scratch and did kind of nutrition education in a fun way with kids and food, and actually were able to track their BMIs coming down. And so these are the kind of fun, behavioral oriented and team-based things that can really make a difference. And if they can make a difference in Spokane, they can make a difference in a country around the world as well.
Exactly. And there's so much to take advantage of there. And I love that it's active in a positive way, right? Rather than punitive. Rather than, you got to lose weight and, feeling that pressure. We've got to be thinking about this in a more creative way. Well,
we're really excited to have you on the campus, to have you address our students at commencement this afternoon, and thank you for the work you do with Global Health Alliance and for reaching out so this is really becoming a statewide network.
It's my honor and privilege to be here.
Great. Thank you.
Thank you.
Thank you for joining us. For more information, please go to spokane.wsu.edu or wghalliance.org.